Coming up. They say that extraction orthodontics is like lazy ortho because you're pulling teeth and then pulling everything back essentially. But that comes at a cost because you're pulling it back, but the tongue is attached to the lower jaw. So when you remove those bicuspids, you're pulling it back into the airway, as well as like the joint space. Don't people with bicuspid extractions have a much smaller joint space?
Yes, that is unfortunately the case, that we are restricting, we are something that the body is not. Again, we are forgetting about the nose, a space of the nose. We're forgetting about the space of the mouth, and we are worried about the position, class 1 position of the mouth. You know what I'm saying? Just like putting the emphasis on the right place. Basically, we have the periodontal ligament, this purple ligament that is around the tooth. Among the blood supply and the nerve supply, everything that the tooth needs to be nurtured and to be connected with the bone, there are stem cells within this periodontal ligament. And the way that I explain to my patients, I say these stem cells are undecided. They don't know what they're going to be, depending on how we treat them. During conventional orthodontics, with the way that we approach them, we activate the bone dissolving cells, which are called osteoclasts. So those cause resorption of the bone, dissolve the bone in one side, and then we have to wait about sometimes over 12 weeks, which is a long time for the bone to be deposited on the other side. Through a gentle massaging forces, which is accomplished by fast braces, and I explained to you how that works. Rather than activating bone dissolving cells, we convert those stem cells to osteoblasts, which are bone forming cells. So from day one of braces, what we're doing, we're creating bone, alveolar bone. Alveolar bone is this jawbone, what you see in here. We're building bone, and then the teeth, when they have room, the roots, of course, the fast braces moves the roots at 3-dimensional, which is incredible. And that 3-dimensional movement is one of the reasons that activates the bone, like draw the bones with it. So we're building the bone. And if you're building the bone, you don't have to extract teeth to make room, because
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode.
Hi, everybody. Welcome to the Munch Bunch podcast. It's Kimi Nishimoto with my homegirl, Megan Van Noy.
Hello.
And today we have Dr. Mary Afzali. Dr. Mary has practices called Lifetime Dental. She's in Lake Forest in the Orange County area, Rancho Cucamonga, San Bernardino, and then Riverside, California.
Woohoo.
And what's amazing about Dr. Afzali, I'll let her give a little explanation about who she is, but she can do these incredible expansion cases in a very short time period. She showed me her cases before, and I'm like, Mary, this is like impossible to do in this short of time, but she does it, and people have great, amazing results. So we wanted to have her come on, highlight her, and then have her teach us a little bit about how she does it, what system she uses, and also the case against doing bicuspid extractions. So, Dr. Mary, just tell us a little bit about yourself, how you started, how you got into doing the fast braces and expansion, and just give us a little bit of your story.
Sure, absolutely. Thank you so much, Kimi and Megan, for having me. I love to share some food for thought with your audience, and with the hope that this will be useful in making a correct decision. So basically, I've been in practice for over 20 years, and I was doing a lot of full mouth reconstructions. That means like 28 crowns, treating temporomandibular joint, like jaw pain, problems for my patients. And I was getting fantastic results with crowns, bridges, and restorative aspect. However, I always thought that, my nature has been always into a very holistic, natural approach and really helping the body to find its path and assisting the body to be in the right position, guide the jaw to be in the right position. This was always my goal. And although I was getting fantastic results, patients would no longer have joint pain and their smiles were beautiful, I expected it more. And because of that desire, I continued into searching for orthodontic techniques that I can use in formation of bone and really guiding the body to generate bone where it is needed. This is a very simple, lame way of saying it, but that's the simplicity of it.
Yeah.
A system that would not just shift teeth, but it would create the foundation for the teeth so they complete their eruption, they come out, they find home. That's the simplest thing to say. And the key is, and as I show you some of my cases, you see what this really means when you have teeth to go where they belong to. That means their function is restored and they are in their best position possible. I studied a lot in about the evolution of our dental apparatus, mouth, what it took to get us to where we are, and also the changes that have happened in new generation and modern and industrial living. And from all of those and a study of our diets, how it had impact on our jaw, I came up with this concept that if I'm helping my patients, that would not be by extracting their teeth or sending them for jaw surgeries. I understand there are always exceptions.
Right. Well, absolutely.
Yeah, there are some cases that probably extractions or surgeries are inevitable. But from what I have experienced, whomever has come to my office, I've been able to treat them without extractions and without surgery, and in a very short period of time. The systems, I use different systems, and sometimes, I use different techniques, even if a particular system that I'm using. But the main system that I use is fast braces. I am passionate about what fast braces does because it works on formation of bone. We generate bone. The whole process of orthodontics in the conventional way is by disposition of the bone from one place to another place, which goes through resorption of the bone cycle and then formation of the bone in another place through activation of bone degenerating cells, which are called osteoclast. I don't want to be too technical, but there are around the teeth. In fact, I can just grab my model and share it with your audience, so it's easy.
I love the idea of fast braces, you guys.
Yes.
I don't know why it's not more common, because when she taught me about it, I was like, that makes so much more sense. And it's she'll show you cases, but there's things that she does that are amazing.
So basically, we have the periodontal ligament, this purple ligament that is around the tooth. Among the blood supply and the nerve supply, everything that the tooth needs to be nurtured and to be connected with the bone, there are stem cells within this periodontal ligament. And the way that I explain to my patients, I say these stem cells are undecided. They don't know what they're going to be, depending on how we treat them. During conventional orthodontics, with the way that we approach them, we activate the bone dissolving cells, which are called osteoclasts. So those cause resorption of the bone, dissolve the bone in one side, and then we have to wait about sometimes over 12 weeks, which is a long time for the bone to be deposited on the other side. Through gentle massaging forces, which is accomplished by fast braces, and I explain to you how that works. Rather than activating bone dissolving cells, we convert those stem cells to osteoblasts, which are bone forming cells. So from day one of braces, what we're doing, we're creating bone, alveolar bone. Alveolar bone is this jawbone, what you see in here. We're building bone, and then the teeth, when they have room, the roots, of course, the fast braces moves the roots at 3-dimensional, which is incredible. And that 3-dimensional movement is one of the reasons that activates the bone, like draw the bones with it. So we're building the bone. And if you're building the bone, you don't have to extract teeth to make room. Because the truth of the matter is, if you have extra teeth surface, or basically you have more of teeth in an arch size, the arch size is not accommodating the teeth, the size of the teeth, and the length that is taking. You have either an option, an orthopedic approach, which is building bone, like I'm doing, or you have to remove teeth to fit the rest together. There is no other option. And when you remove teeth, the smallest premolar tooth is about 10 millimeter. 10 millimeter is about yes. And can you imagine that on each arch, 2 centimeter, we have reduction of the palate and the lower jaw? And yes, exactly. I'm going to grab another model.
Do it.
I'm glad that she brought that up. I'd never realized like the actual width of the premolar. That's actually kind of big. Like,
it's big.
Think about your airway. Like, I know that I've got like a 7-millimeter airway. My airway
is bigger than mine.
And mine sucks. If I had 10 millimeters forward, I can't even imagine that would be like so much bigger than what I've got now.
Yeah. And I didn't even have premolars taken out. I just have small airway.
When we are talking about extraction, we are talking about reduction of the size of palate.
Mhm.
We are talking about reduction of the size of the floor of the nose.
Mhm.
And we are talking about reduction of the space for tongue.
Mm-hmm.
So what happens when, we don't take care of any of these thoughts and just immediately put our young children in that position?
Mhm.
We're creating a future which is a little bit hard, or it can be hard.
Oh yeah. Oh
in this
yeah.
situation,
Oh, 100%.
because
Mhm.
we are not just extra, I guess what the message that I have for people, in centuries, dentistry have come up to a different level. From when we look at barbers pulling teeth, and when we look at the history of dentistry, there's still a lot to appreciate about teeth and really know the value of each tooth. I don't want to get into a different subject, that each one of the roots are connected to an organ in the body. And when you remove that, yes, that would be a whole different subject. But
Oh, I'm fascinated. What is
I see part 2 coming.
Yeah.
absolutely. In fact, I had patient with cancer that came to me, and it was just like putting pieces of puzzle together.
Mm-hmm.
The second molar connected to the breast, and that was on the right side, I believe. And that was exactly what it was, and we got the molar removed, did all the very thorough application of making sure all the infection, everything is out. And then, she wanted to have a holistic approach. Again, I'm not going to that route but I'm just saying that removal of teeth should be absolutely the last option. And they're all connected to the meridian pathway. As I said, that's a whole different subject that I would love to talk about it. If your audience is interested, and if you guys are interested.
Oh, definitely.
Yeah, part 2.
Yeah, exactly.
We love a good part 2 around here.
Absolutely. So basically, that's from the perspective of how the airway is affected. And then I'm going to grab my other model. And you see that we have the connection of the teeth and the occlusion to the position of the TMJ. We cannot change this relationship in here and think that we're not changing anything in here. Definitely, we are impacting the joint. And I have had patients that had severe joint pain, really were having a rough time. And after, helping them with the overall bite and everything, even after extraction, they gain a huge amount of relief, which I can show you some of the cases.
Oh, we would die. We would love that.
Yeah.
I think that's a really good point, Dr. Afzali, is like they say that extraction orthodontics is like lazy ortho because you're pulling teeth and then pulling everything back essentially. But that comes at a cost because you're pulling it back, but the tongue is attached to the lower jaw. So when you remove those bicuspids, you're pulling it back into the airway, as well as like the joint space. Don't people with bicuspid extractions have a much smaller joint space?
Yes, that is unfortunately the case, that we are restricting, we are something that the body is not. Again, we are forgetting about the nose, a space of the nose. We're forgetting about the space of the mouth, and we are worried about the position, class 1 position of the mouth.
Mhm.
You know what I'm saying? Just like putting the emphasis on the right place, looking at, have a reference point that is related to overall health. That's how I look at it. And as I go through my cases, I think your audience will have a better understanding of what.
Yeah. Do you want to just start showing us?
Sure, absolutely.
Okay.
We want to introduce the spot for Tots Course, a parent's guide for toddlers ages 2 to 5 for mini Myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue-tie healing protocols, and then we have Jenny June going over sleep hygiene and Kelsey Baker going over feeding therapy and body work. The course is $297 and the link will be in the description.
I think that's a really good point, what you were saying about the reference point, because when we're in the dental eyes, we look at, okay, let's check your bite. Okay, the molars line up, the canines line up, there's no cross bites, yay. But then the other side of it is we also have the skeletal occlusion. Like, is there the retrognathic, the tucked back chin? Is there the prognathic chin, where the chin's way forward and the mid face is very flat? There's also the skeletal occlusion.
Yeah. It's not just how the teeth line up anymore, right?
Mm-hmm.
We've done decades of how the teeth line up, and where has that gotten us, right? Like, we see so many adults with jaw pain and sleep apnea and panic attacks and, you know, kind of the inability to cope, but like they've got a nice straight smile, right? Like,
Absolutely. No, you mentioned I love the way that you said the skeletal occlusion, and that's exactly what my focus is. I call it a skeletal harmony, but you know,
I love that. Skeletal harmony
coming together. Yeah, exactly. So this case, in fact, I saw my patient yesterday. It's not done yet, but I was stunned myself, because in a very short period of time, it's a matter of, I don't know, what, maybe 3 months, 4 months. I want to show you guys the changes. This is the palate. Again, you know, first thing that I look, my reference point is the palate. I see asymmetry. I see a semi-V shape, a deficiency of the premaxilla area. You know, these are what I look at. And a lot of these, I selected class 2 cases to share with you guys. Of course, I can go over my case study book also and show you some class 3s, but
I would love that.
3, sure. For these first 3, I'm selected class 2 cases. So, and I have a point, because these are unfortunately the cases that are subject to bicuspid extractions the most. And my point is, if you pay attention, the problem is not really in the premolar area, although it's deficient, you know, unilateral deficiency of the alveolar bone. This area, the front area, is called premaxilla. And this is where the deficiency is. As all of these cases have one thing in common with the degree of severity, that this area, they have deficiency. So extracting this area is not going to solve the problem.
Yeah. And for our listeners that are listening, not watching, you should go back and watch this on YouTube or Spotify. But she's basically pointing to the canines forward. That's where it didn't grow out to its fullest capacity.
Yeah. And so taking out teeth behind where it didn't grow doesn't make any sense, because that's not where that growth is missing.
Yes. And this case, if you look at it, you know, a lot of these people have been told they need jaw surgery, you know, when they see me. And if you look at it, you can see the angulation of the palate. And you can see the molar has come down which is extrusion, into the lower space. So we have severe situation here. We have gum conditions here. We have patient is knocking out her teeth, and gum condition, bone loss, and this is the overjet. This is the overbite. The people probably know it as an overbite. We call it as overjet, and there's a horizontal overbite. This is about 20 millimeters.
Whoa. How
Wow.
much is that in scale? Like, I know that's bigger than our periodontal probes, but
You're talking about 2 centimeters.
wow.
Tremendous. When we look at this amount of discrepancy, that's why extraction and surgeries are what comes to the mind first.
Right.
But I want to show you what she looks like. Yeah, see, this is what
Wow.
Wow.
Yeah.
So for our listeners, it looks like, I guess you could call it like bunny teeth. They're really flared out. They're super sticking out, as if like an adult was sucking their thumb. Like that's the sort of bite that she's showing us right now.
Yes, and basically just that you can imagine the teeth need to be touching each other, and the normal overbite is between 2 to 3 millimeters, and we're talking about 20 millimeters. So 10 times more than what is normal.
Wow.
And this is unfortunately the reverse curve of bite in the lower arch is inherent to this type of cases, because the upper jaw, the teeth are flared out, the bone is in an angulation, the palate is in an angulation, and then the lower jaw in the front comes up, and then the back area of the lower have a reverse curve. There is a curve in dentistry for the bite between the teeth, and especially on the lower arch is called curve of Speed. S and P as Peter. And this is just a name, but these patients have reverse curve of Speed. This is typical. And then temporomandibular joint pain is usually associated with this type of
I believe it.
And this is the X-ray. You can see
Oh, what a mess.
You can see the rotation of the canine. You can see the missing teeth. I always ask my patients, I say, why did you lose your teeth? If the bite is right, if the relationship is right, if the home is safe, teeth will not get decay, even decay, in my opinion. And in years of practice, I've seen it, that if patient has good oral hygiene and they have no mechanical stress, they would not really get even cavities. So the patient, and she's pretty young, have already lost another second molar on the teeth, and then another one on the bottom.
Yeah, 3 teeth.
First molar on the right side, and it's just like a lot of missing teeth and a lot of unfortunately trauma. And then another concern, she's already having arthritic bone relationship. The lucky thing is that I got to help her at the time that the bone of the jaw has not been deteriorated fully. This bone is better because you can see the denser bone around the condyle. Condyle is the head of the joint that goes into the articulate with the skull. Still she has more bone there. In here she has lost some bone, but still I'm happy because I am very hopeful that she will be good by what we are doing for her. And this was her lower, as you see, and this is another version.
Mm-hmm. Did she grind her teeth as well?
Yes,
She's got front,
absolutely.
she's
You
got
see,
wear.
you see
A
the
lot of wear.
stress line.
That
See
stress
that?
fracture.
Yes. So I saw her yesterday, and this is
That's not even the same mouth. Oh my gosh.
even her
Wow.
line is lined up.
Yeah.
Wow. And how many months was this, Dr. A?
About 3-4 months, I think. I have to look
Oh
exactly.
my God.
All I have to do now is align this area,
Wow.
and
You guys
basically,
really have to see
basically
this
it
to
will be
like
done. It will be
believe
done.
it.
And you look at the
Wow.
palette. So again, we go back to the
Gorge.
original one. So you guys see what we started it with.
Unbelievable.
I want to show you this bone also. Please remember on the left side, and we'll see. And also this bone. So, and see, we started with this palette,
Mm-hmm.
and this is our palette.
Wow.
Unbelievable.
That's why I say I have a reference point, and my reference point is the palette.
Wow.
Because it is the foundation for the mid-face.
Right.
Is the foundation to support the orbits of the eyes. It is supporting the floor of the nose. What other structure do I have in the mouth that is doing that much function, knowing that it also guides the position and growth of the lower jaw?
Mm-hmm.
So you when you put your perspective in the right situation, then I think you will do the right thing, and your patients benefit from it. So I did one other thing that I want to mention. There is a procedure called IPR. That means interproximal reduction.
Mm-hmm.
This, again, it depends on how you approach it. First of all, I try to really be creative and not use it as much as I can. And when I use it, then basically it's a little small recontouring of the surface of the teeth in between, so you can bring the teeth together. And I use that with hand instrumentation. I don't use a bear for it, like a drill. I take my time and go and basically remove dusts of teeth. But you see the contact between these teeth?
Mm-hmm.
Areas of contact, not points of contact. These are protective of gum. If we have points of contact, food can get in between. It can really create a problem. But you see, these are all details that, I think patients deserve the best.
Yeah. It's like when you get that filling and it like pops in, but it doesn't quite seal the food out, and you get food trapped in there all the time. So what she's doing is just bringing those teeth so they have a nice harder contact to keep that food out. So interesting. Dr. Afzali, did you use a palate expander in this case?
No.
Wow, this is just fast braces.
Only fast braces, and with my particular techniques that I use, using different things. Is not a technology or anything. It's just my tools that I have, like with the elastics, with my ties, with power chains, just chains, just the rubber bands that we put on teeth. And when you go to the orthodontist and they ask you what color you like, you see, basically those, you can do magic with those.
Really?
Yeah, absolutely. And with the wire, I just have one wire. Fast braces has only one wire from the start to finish. And that wire, I use it as needed in different positions. To get my bone growth when is most needed.
Wow. And looking at this, the gum tissue looks so healthy. For usually braces, the gum tissue looks like hamburger meat.
That's what I was going to call it too, hamburger meat. Yeah.
Yeah.
That's exactly.
Gosh, that's gorgeous.
You're a hygienist. You're a dental hygienist, and that's quite a compliment to hear from you. But you see the stippling of the gum.
Yeah.
I'd say the stippling's amazing. I haven't been in hygiene for almost 4 years, and I can still appreciate good stippling.
When you look at it, is when the foundation is right, you do it in a right way, and also look at this bone formation.
Wow.
I want to show you. Let's go back to the original.
The bone. Yeah.
I wanted to show you guys what we have. First of all, look at what the gum look like here on the right. And
yeah, I was going to ask about the recession. Yeah.
The left side. You look at this.
Yeah.
So what I did, we got bone growth, but I also did a small, we call it enamelplasty, recontour this. So it's not a foot trap anymore. Did the same thing in here. So I would say is orthodontics with love.
Yeah.
Honestly, because these are things that it's life-changing for patients.
Oh gosh.
I mean, this patient no longer needs to go and see a periodontist. By the way, I have periodontists in my offices. I have oral surgeon in my offices, but I work so hard to do whatever I can do with ortho so my patients don't need to see my specialist.
Amazing.
Because I'm confident I can help them. And you see, this is, this just really brightens my heart that she didn't have to go through osseous surgery, which is a gum surgery that, the bone is drilled out. And it just makes it more challenging for the, and, for the body to work around. But now she has this beautiful bone built in here, this nice contour, finish her up, and
amazing. Yeah, before it's like a nightmare hygiene patient, and then now it's like, okay, yeah, I'll take you all day, every day patient. I actually have an unpopular opinion, but I think a lot of these patients that are having perio surgery or like advanced perio problems, bone loss, I think a lot of them have an orthodontic alignment issue as well as bruxism. And a lot of times that's never addressed. They just do surgery, and that surgery is tens of thousands of dollars. It's not fixing the root of it. And they end up needing it multiple times, and they don't want to do it multiple times.
Yeah, absolutely. And, the expense of it is one type of pain and challenge, but the experience is
it's not brutal. Yeah.
It's not a pleasant experience. And really, when you look at it, we are removing teeth structure. Bone. We are removing bone. And,
So, Dr. Afzali, we told everybody where you're located, but how also can they find you on social media? Where would they find you?
This is my IG, Dr.Afzali, and my Facebook is Dr. Afzali.
And then the name of your practice is?
It's all of them are Lifetime Dental.
Perfect.
And then they are in Orange County, Lake Forest, Rancho Cucamonga, Riverside, and San Bernardino in Southern California, all four of them.
And of course, you guys can find Kimmy and I on social media at the Munch Bunch podcast. You can find me at NWMFT and Kimmy at Mouth Muscle Memory. Thank you again, Dr. Afzali, and we are looking forward to chatting with you again soon.
Sure, absolutely. Thank you so much for having me.
Absolutely.
So fun. Both of you. Yes, absolutely. And I love to come back. Thank you, Kimmy, also.
Yes.
Okay.